Hello, my name is Oluwatu Sianji. I'm a student of Nightingale College, and today I'll be changing an ostomy bag for my patient. Before I go into my patient room, I already gathered my supplies: 2 towels, 1 for cleaning and 1 for drying, stoma paste, Sharpie, scissors, stoma guide, and clean gloves. Okay, let's begin. I'll perform on hygiene. Knock on the door, pull curtain for privacy. Hello, Mrs. Smith. My name is Oluwatosin. I'm going to be your nurse today. May I see your ID band, please? Can you verify your name and date of birth for me? Thank you, Mrs. Smith. We have an order to change your colostomy bag. Is that okay with you? Okay. Do you have any questions for me? Okay. Okay. Now I don clean gloves. And I take this up and I go into the toilet to dump the content and put this inside a waterproof container. Now I take off my gloves, perform eye hygiene, and down another set of gloves. And now I want to take this off because this is how they save to. You want to take it off slowly and gently so that you don't pull on the patient's skin and actually hurt the stoma. So you want to pull towards the stoma gently in the direction of that grip. Once you get everything open, you then lift it slowly and trash it in the waterproof container. Now I would doff my gloves, put on clean gloves, sanitize my hands before that, and don another clean gloves. This step is not really necessary, but I like to don clean gloves once I touch fecal matter, so because I'm gonna be working with a new clean things right now. Like I'm gonna be putting on clean elements, so I want to use warm water with washcloth to clean around the stoma. I'm gonna clean around the stoma and on top of the stoma a little bit. It might bleed, which is pretty normal. It might bleed a little, which is normal. And now I want to dry it up in the same direction around the stoma and on top of it. And you want to dispose of that. Now that it's clean, I can observe it. If it's gray, if it's white or purple, which means if it shows all those colors I just mentioned, it means it's not getting perfusion, but it's beefy and red, which is good. So, and it's not retracted, which is nice as well. So now I'm gonna go ahead and measure it. Let's see, that's too big. This is perfect size. So now that I've measured it, I will take my stoma here, I'll place it on it, use the Sharpie to measure it, to circle it out, and step it aside, and use the scissors to cut around it. So now, before sticking this, I'm going to use the stoma paste and put it around the stoma so that it could help it stick better. Now that it sticks better, I will take off the adhesive, the paper to expose the adhesive, and I would place it on it, making sure it sticks. And now I will attach the pouch onto it, clicking it around and secure it. Doesn't matter, clip the bag. Put my patient in a comfortable position. Mrs. Smith, I'm done. I'm just gonna lay you flat. Here is your call light, here is your water and your Kleenex. Do you need anything right now? No. Okay. And then I will gather my supplies, doff my gloves, perform on hygiene, take all the one side on it, put it in the dead-weighting net, and my supplies, close the room. Patient is comfortable. Now, I already performed my hygiene. I'm going to document what I just did, my observation, and my consents to the provider, and exit the room. Patient has coli. Curtain will be pulled open according to the preference of the patient before I leave the room. Thank you.